Hi everyone, I'm Bolu Aweso, an Associate Director with the Association for Supply Chain Management under the Global Health Supply Chain Initiative Program. I'll be presenting to you a workshop today on the Global Health Maturity Model Assessment Tool, the 8th version, which is the online version that was recently deployed by ASCM. Co-presenting with me as well is Rabato Tabadi, a management consultant with BV OPEX. Today, we'll be speaking about the Global Health Supply Chain Maturity Model tool, which is a tool that is used across the countries to measure the performance of supply chains. Different programs from different parts of the world have used it to see how well they are performing in their supply chains and to identify areas of improvement to move their goalposts forward and to be able to achieve the end goal, which is ensuring accessibility and availability of health commodities to our clients. Before then, I'll talk briefly about ASCM and what we stand to do. ASCM's vision is a better world through supply chain. And by this, we mean that the world can be better by improving our supply chain processes from across the world and being able to give more to the society. ASCM is a global leader in supply chain organizational transformation, innovation, and leadership. And we are the largest supply chain association right now. It's a non-profit organization, and we're an unbiased partner, connecting different companies around the world through our thought leadership programs in all aspects of supply chain. ASCM was built on the foundation of 60 years of APIX. So initially, ASCM used to be called APIX, but in 2019, the name was changed from APIX to ASCM. We are world-class in certification programs, and I'm sure a lot of you are quite aware of the different certification programs we hold, such as the CSCP, the CPIM, the CLTD, and other endorsements and courses that we run. Our differentiator is a large number of global networks from different parts of the world. We're headquarters in Chicago, and we have over 45,000 professional members from different parts of the world in over 100 countries, with 181 North American chapters, 1,600 active volunteers, and over 100 staff. ASCM has aligned with over 300 corporations from across the world. We are in the 200, we have about over 200 global 2,000 corporations, over 1,000 in the over, and same as well for the Fortune 1000 and Global 250. We're covered in about 19 industries, from 27 of them with headquarters in different countries of the world. Whereas 60% of our corporations are also listed in the Gartner Top 25, and 7,500 plus of these employees have APIX certifications, and we have over approximately 1,000 ASCM thought leadership professionals from across the world. I'll show you a short video of how ASCM is trying to improve the world through supply chain, like I said, which is our vision.
Every day, every instant, there is a symphony being played on the grandest scale. A feat of precision and coordination, unparalleled in human history, connecting billions of lives and empowering communities to find their purpose and their passion. In private, in public, at home, and at work, supply chains are transforming the world. As the world becomes more connected and more competitive, companies are striving for more than efficiency. And ASCM is helping supply chain professionals rise to the challenge.
When we improve supply chains, we uplift the world. Better supply chains empower communities and individuals. It's a chain reaction. There is poor access to medicines in these countries. Most of the issues are linked to insufficient supply chains. By leveraging on ASCM's proven best practices and global network, we aim to improve supply chains in Africa and in turn ultimately improve the lives of our people. Communities like these finally thrive.
It's a seismic shift. Commerce, infrastructure, and communities are lifted up by rising standards in the global supply chain. The most pressing ethical issues are finally being addressed: corruption, poor working conditions, environmental issues, workplace discrimination, and unethical sourcing. ASCM is helping to transform countries, corporations, and communities. It all starts with the people. And the impact begins with you, the first link in the chain. A better world through supply chain.
The video shows how ASCM is trying to improve access in different communities in Africa, and this has been part of our priorities over the past couple of years when we started the grant. And also, we've had to partner with different donor organizations to be able to deliver our mission. So ASCM right now has a long-standing strategy that synchronizes all current and future donor investments in targeted countries. At the moment, ASCM works in Africa, in Nigeria, Senegal, and Kenya. And we have different donors that we're working with right now. We have the Bill and Melinda Gates Foundation grant. We have a technical support from the Global Fund, and we also have an ongoing relationship with the United Nations. And part of ASCM's interventions in these countries include building sustainable supply chain communities to dramatically scale up the global health supply chain maturity model that is being displayed today. We're driven by best practices, and we introduce globally recognized adapted methods to build these capabilities within ministries of health. So we work with ministries of health staff to build their capabilities in supply chain and to be able to administer this tool to measure their performance. First of all, we've also done is to try and grow a supply chain community within the network which we engage. So we come together, get ASCM membership, and create platforms where they can engage and interact and share best practices and ideas on supply chain. Part of what we've done with the global health supply chain maturity model is to leverage on both on the tool and on the customer feedback to be able to improve on that tool. And this we have done by facilitating both self-guided and other forms of trainings for the tool. So we have connectivity with, we'll be able to connect with other models and align with the Ministry of Health strategic goals, such that when they are building up their supply chain strategic goals, they also factor in the supply chain maturity model so that each time they're able to measure the performance of the supply chain, even after try to achieve or implement their strategies over time. So quite a number of surveys have been held in different African countries. We're going to see that later. And we're also building the capabilities of the staff of those ministries of health to be able to improve their technical skills. And this we have done through formal trainings. We try to hold certifications for them. And we also have the transformation learning programs, which leverages some global standards from across the world to be able to identify with the staff and to build their capabilities and ensure, most importantly, sustainability, such that even when donor funding is no longer there, when ASCM is not there, these ministries of health have enough capabilities to be able to cascade all that they've learned and to be able to implement this and even train other staff over time. So the Global Health Supply Chain office is manned in two different areas. There's the global office and there's the African office. The global office is headed by Abe Eshkenazi, who is the executive sponsor based in the USA. We have Dan, we have Glenda. Glenda is the program director. We have Peter Bolfus, who's also at the program office. And we have Fernanda, also at the program office in Brazil. The Africa team is a technical team, where we have Glenda still as program director, we have Bolaji and Bolu in Nigeria, Eric and Judith in Kenya, and Dr. Ngom and Clement in Senegal. So part of what we'll be doing today is to talk about the tool. We're going to introduce you to the tool, what it does, and we'll also have a demonstration of how the tool works. So I'm going to be handing over to my co-presenter, Lerato, who is going to introduce you to the tool while I come back to do the demonstration. Thank you.
Thank you, Bolu. Good day, everybody. My name is Lerato Tabede, CPIM. Thank you for joining us. Today, I will be taking you through our Global Health Supply Chain Maturity Model version 8. From a public health supply chain perspective, the ultimate goal is to ensure that we deliver health products and information so that we can give our patients quality care. The public health supply chain handles thousands and thousands of stock keeping units, and all of these are delivered to different and lots of dispensing points. The health supply chain space is characterized by an ever-changing environment, which depends on the disease patterns, such as COVID-19, as we've seen in 2019, the technologies that emerge, and health reforms that are put in place. So the systems have to be adaptable and flexible. Because the public health supply chain sector is not just a stakeholder, but numerous stakeholders such as government, donors, private sector, faith-based and community-based organizations. It is also the world's largest and fastest growing industry, with an increasing number of products, programs, and patients to manage. Why do we use the Global Health Supply Chain Maturity Model in the public sector? Well, this assessment informs two key processes. One being the evidence-based investment and planning, and secondly, the performance management. So it provides a tool for us to inform and guide supply chain countries and donors on how to invest, how to make their investments. It informs countries of strategic planning and their performance management processes, and plays a very critical part in ensuring that supply chain policies and decisions are made based on accurate and good best practice information. The performance management provides a comprehensive picture of what a national or regional supply chain current maturity level is and what their current performance is. It also monitors the impact of interventions and improvement activities that we put in place, as well as monitoring the progress over time and against a set performance indicator of targets. The Global Health Supply Chain Maturity Model is a self-assessment tool that can be used by different sites, different supply chains, counties, countries, regions, for them to independently assess their own supply chain needs. It helps countries to increase their supply chain performance by focusing on improving their constraints. And it is designed to measure strategic, tactical, and operational processes all in a single tool. So there's no one tool for strategic or tactical or operational, but you're able to put them all in one tool and be able to look at the assessment from that perspective. Our indicators are clustered into different categories based on critical components, such as transportation, inventory management, storing, expiry management, and more, which I will show you later. Each category is evaluated by a process maturity, and it is based on the selection of the most probable answer. Our results are then plotted against the continuum across 5 different levels, and the overall maturity is based on the theory of constraints, where we know that we have to concentrate on the elements that causes the lowest performance within the supply chain and which pulls down the overall supply chain performance. And with that, we're able to target specific areas that are pulling the supply chain down, improve them, and move over to the next constraint. When we look at the maturity model, if you look on the graph on this side, we've got 4 of these levels where we have our bronze level, which will be our base. And then we move over to our silver, our gold, and our accredited. And as the supply chain performance improves, the level and level that the supply chain is placed on also goes up. So we know that there's a relationship between maturity and the supply chain performance. The guiding principles and objectives are based on leveraging the voice of the customer. The customer is who you want to hear, you want to understand their needs, and it is them who we are aiming to assist. We look at the past successes as well as industry best practices. we aim to reinvent and digitize the maturity model assessment survey, which we have already done with our microsite. The MPI and UpMetrics have brought industry best practice in supply chain benchmarking, survey construction, giving research-based insights, data collection, integration, and impact reporting. So visual things that people can see and use. The version 8 maturity model is cloud-based, and it's a survey that is leveraging Qualtrics and UpMetrics data platform, which gives us real-time integration, reporting, visualization, progress monitoring, and goal setting. Like I said, all in one. We've redesigned facilitator qualification, training tools, and follow-up. So the qualification process for partner facilitators that we provide ensures consistent, high-quality assessments and maturity improvement for targeted supply chains. Our process also includes the ASCM quality assurance point to ensure that the data of integrity in our initial baseline assessments, as well as our expectations for biannual progress update from partners and country stakeholders. This all ensures visibility, and we know what is happening, and we can keep up as we monitor the progress. We also look at integrating the assessment program with the efforts that have been made by the Ministry of Health. And it is a closed loop process, which begins with an initial maturity assessment. Once the initial maturity assessment has been completed, we then move over to the application of the improvement approach. And we focus on setting goals continuously, making sure that we keep reporting on action-based results and making data-based decisions. The Global Health Supply Chain Maturity Model has got 20 categories, and all of these categories are linked to SCORE principles, which I'll show you later. We have a service delivery point from a health facility visibility. We look at inventory management, order management, store visibility, store inventory management, store order management, the store operations, transportation, expiry management, procurement, infrastructure and assets, performance management, analysis and evaluation, demand planning, supply planning, fund management, financial management, as well as governance, staff training, and patient-focused performance. All of these, like I've said, are powered by the SCORE, which is the ASCM Supply Chain Operations Reference Model, where we look at plan, source, make, deliver, return, and enable. So all of these talk through also to the voice of the customer and is a global standard for defining high-performance supply chains. They all linked into the maturity model mapping to the SCORE digital standard, where when we look at the health visibility and inventory management, they belong under the make and deliver processes. When we look at order management, it comes through the source, make, and deliver process. And when we look at warehousing, it's we have it between the make, source, SCORE processes, and transportation and patient-focused performance all go on to deliver. And when we look at supply planning and demand planning, they fall under the plan processes. And then we also have our enable processes such as performance management, fund management, financial management, as well as governance. And the return will be from an expiry management perspective. How we use the tool, we select a team, and it's a careful selection, and you want to get the team that is involved from different levels of the supply chain, and they work together to answer the questionnaire. So it's a very integrative and robust way everybody can give input and debate around how the questions have been answered. The team then completes the online questionnaire. Once the questionnaire has been completed, the team reviews the performance, identifies the weakest link, and once that has been done, we then perform a root cause analysis, and from the root cause analysis, we look at what actions can be taken and what to how to prioritize those actions. Once that has been done, a formal action plan is then tabled. And from that action plan, there's dates, there's targets, there's KPIs. And then we use those results to support the request for resources for projects that will improve performance by removing the supply chain constraints. Now, this process can be repeated biannually. And what's important is that we work on a business case that we want to advance. So we want to advance through the different levels, from bronze to silver to gold to platinum. We also want to increase visibility and focus on process improvement. For more information or to do the assessment yourself, you can go online onto our maturity model assessment site, which is www.ascm-ghc.org. I will hand over to Bolu now, who will do a real-time of how we use the maturity model.
Thank you. What I intend to share now is a demonstration of how the maturity model assessment tool works. So we'll be going to the site. The website is displayed on my screen. And from that website, we'll be able to access the tool and do a demonstration of what the tool is like, and also have a visualization of the output that comes thereafter. So join me as I go on this journey with you to have a demonstration of the tool. So right now we're on the page that leads to the online tool. And what I'll do is just to give you a brief rundown of what the contents of this page are, and then we'll go into the tool proper. So the tool, which I've showed you with the website before, is ASCM-GHSC.org. That is where this tool is located. So when you open your browser and get to this page, you have this tab here that talks about ASCM, the ASCM Foundation, and the team, which I already described earlier. The tab here actually talks about what the maturity model tool is, and also the 8th version, which is the one we're working on right now. And then you have a tab here for training and support. The training and support has different support materials that can help you to either train on using the maturity model assessment tool, or how to go about your improvement methods after you have gotten an output from the assessment. So this whole page here gives all the access that we need. And then if you scroll down a little bit here, if you want to do a demonstration of what the maturity model tool is like, you can also come here and click on this tool. This just gives you a demo version, so you can go through it, go through the questions to see how well used to it you are before you eventually start an assessment. So the demo site is just for your practice. It doesn't count towards what your assessment scores will be. Now, right below that, there are a couple of other tabs that you can open to be able to have some more information. Now, if you want to begin an assessment, you click on this space that has an assessment now. Now, this takes you right onto the real life assessment, the online version of the assessment, but we won't be doing that right now. I'll just take you through some other tabs before we continue. Now, there's a playbook in the maturity mode on the online version, and this playbook describes quite a number of support materials so that you would need. So we have the English version and the French version. It just helps the facilitators to accustom themselves to how the assessment to be performed, and also helps teams to understand the output. So part of the materials that you can download in the playbook are the maturity model facilitator guide. That is for if you're having a classroom facilitation for the training, or if you're having a virtual training, there's also a facilitator guide that you can download for that. There's a checklist to help prepare for the training. And then there's a companion, a facilitator guide companion, which helps in presentation instructions and how to conduct the training. We also have a facilitator guide companion for the virtual as well as the in-person. And then we have the participants guide that can be provided to the participants for them to read ahead of the training to know what the training is also going to be about. Now, there are quite some words in the questionnaire that one may not be too familiar with. So we have a glossary that describes most of those terminologies that you may not be used to. And then there's an improvement plan document here. Now this improvement plan document, there's an instruction for it and also a worksheet. The improvement plan instruction just gives a guide as to how to go about filling the worksheet. Now this improvement plan is at the later stage of the assessment. That is after you have developed your outputs and you have identified the areas where you need to improve. So you need to come up with a plan. So this gives you a guide on how to come up with a plan on what to do. And then we have a directory that just shows the different materials that we have online that have been uploaded and you can support. So we have both the English and the French version, depending on which one you like to use. Now we also have the toolbox and training. Now the toolbox and training is intended to help supply chain teams address the constraints and weaknesses that they've identified during the assessment. So these are just problem-solving tools and techniques that helps you to monitor and improve on your supply chain. So we have the online learning materials. These are just different learning materials that ASCM has put together for you to be able to understand how to go about your improvement. We also have key performance indicators. These are just useful guides for you to set up indicators in order to measure your performance after you've developed an improvement plan. We also have an improvement plan primer. This is just for assessment teams when managing their improvement projects. So you have timelines to be able to guide on how to do that. We have a synopsis of problem-solving tools. So these tools could be the 5 whys. It could be any of those problem-solving tools you want to use to be able to find out why your supply chain is performing suboptimally and what else you can do. So like I said, we also have this in the English and the French version. So any of the versions that is available for use for you and you can understand is what we can use. Now this MM outputs, we're going to go into this later in the presentation when we go into the assessment proper. Now, once you want to do an assessment, you go into you click on the tool. So for now, we're going to be using a demo version, which is the demonstration site. Now, demonstration site is exact replica of the online assessment. The questions are the same, but this is just to provide a form of practice for you when you want, before you do the assessment. So roughly it takes like 40 to 60 minutes if you're already sure of the assessment questions. And so that's why it's good to go through the demo slide to be able to accustom yourself to the questions and the way the answers are presented. And then you can also have a consensus with your team before actually doing the actual assessment. So it's faster and it's more efficient for the whole team. So the first page on that assessment is a profile. You need to generate a profile to be able to conduct this assessment, because this profile links to the data output, which provides your visualization at the end of the day. And this provides also the reports that you're going to have. So we have a place where you have the country, you put in your country, you select the region or states in which you're working at. And then for other countries, really, if you're just assessing for your country, you're not assessing other countries, then you just leave this out of it. Now, here you have the name of the district of the organization in which you're working. So you can put in the name of the organization you're working here. And then there's a drop-down list that asks for the dates, the month, the day, and the year in which the assessment is being conducted. So this is inserted here. And then we also have the names of the individuals that will be completing the assessment. So it could be the team names or any name which you desire to be identified. That is what you can use here. Now we have another drop-down list that talks about the type of organization. It could be private, it could be public, or an NGO. So this helps in order to view later on how private organizations are performing, how NGOs are performing, how public organizations are performing. So for each of the information that you put that is provided here, there's also a way it can be generated to query some other information at the back end. Now, if this assessment is being supported by a donor, you can choose a yes or a no. If it's a yes, you put in the name of the donor, or if it's a no, then you just go ahead. Now, there's an aspect for registration code. The registration code is quite important because that is how we're able to pull up your data on a later date. So if you do an assessment today, if we give you a registration code, if we need to access that information over time, maybe you need to check how well you've been doing by comparing your performances over a period of time. We'll need this registration code to be able to pull up that data for you to assess. So this is very important. If you need to conduct an assessment, you can always contact us to give you a registration code. If you're not using a code, then you can just do a self-assessment, which you only need your email address for, and then the data output just goes directly to your email. But we may not be able to do much for you on that, provide much support on that if it is not registered on our database. Now we have a number of commodities that are registered here for you to choose on if you're working on a family planning supply chain or HIV or vaccines, or probably it's an integrated supply chain. So if it's integrated, you can just list the kind of commodities that are there or want to understand the kind of supply chain you are handling. And then also the kind of stakeholders. It's important that when you're conducting an assessment, you have the right set of people in the hall. So if you're going to have people from the national, the states, or any of the counties, you need to put up their name here so that you can refer to it later if you need to. Now, the selection of these participants for their points assessment is really important. You need to have the right kind of people in the hall. And what do I mean by the right kind of people? The people who actually conduct this work and so are able to give you the right information with regards to what you're assessing. Because if you don't have the right set of people in the hall, it's going to skew your answers. And when you have a skewed answer, your output is also going to be skewed because it may not be a true reflection of how your supply chain is actually performing. So please note this when you're making a selection of who is supposed to be in the hall or be conducting the assessment with you. Now for this question, it just gives a highlight of how many assessments you've conducted over time. If you've never conducted an assessment and this is your first one, you just click 0. But then if you conducted before, I can remember how many, and then you just click whichever one you're able to, you click the ones the number you have done previously, and then you move ahead. Now your primary source of information, this is also very important, and it's tied back again to the selection of your participants. Now you could have first-hand information. That means the people actually doing the job are the ones that are providing the answers. You could also have first-hand experience and second-hand information in the sense that the people doing the job are there, but you're also able to get information from someone that is doing the job, or maybe from some important document that has accurate information. So that could be your second-hand information. Second-hand information could be combined with first-hand information, or could just be second-hand information and first-hand information alone. Either one works, but you just need to be sure that you're getting the right information from all the sources. So once you're done with this, we can now start the assessment proper. Now remember that we said there are 20 categories that are being assessed. That's we're doing an end-to-end assessment of your supply chain. So we have procurement, we have SDM visibility, we have funding, we have human resource, we have warehousing and distribution. So all 20 categories are going to be assessed. Yes, it's possible that your supply chain doesn't handle all the 20. So we have made provisions for I don't know and not applicable. Now these two do not count towards your entire score, because realize that if you're not conducting an aspect or a category in that supply chain, then you shouldn't necessarily be scored for that, because your program is just probably not designed that way. But then if it's something you're doing, then we want you to give the most accurate answer as much as possible so you can have the right results. So we have this going for the 20 categories. Each category has a question. And at the end of each section of category, you have a problem, a question that goes with constraints. Now, constraints are market forces that are beyond your control and they hinder your supply chain performance. So there are times where you know that there's a problem, but the problem is not within your control. So this could be human resource, it could be funding, it could be any of them. So when you get to these questions, please choose all the hindering factors, all your constraints, because this adds up to the performance of your supply chain, and it also helps to identify how to improve on your supply chain. So for this question, this is the only question where you can choose more than one answer. You choose all the answers that best describes what the constraint is for that particular category. So when you're done with all 20, you click on next category, and then you move on. Now, each category, like I said, has a series of questions, and once you're done with it, you click on next category. When you get to the 20th category and you've clicked on all that, it would take you to a page where you get the output. Now, this is what the output looks like. So assuming I've done an assessment and I've come to check, oh, okay, now I've done an assessment. What next? How do I find my answers? What have I scored? So after doing the next category on the last tab, it takes you to this page. This page is where you see how you have performed. Now on this page, you can see a percentage here, you can see team aggregated responses here, and so many other things on the tab. So this tab here has a drop down where you can also access so many other information on the tool. You can query different aspects of the digital visualization, and we'll be going through that. So, and here right now also, you have a download button where you can download what you're seeing here, and you can also share it externally, or you can filter. Now, the filter button, we'll be talking about that later on, but this gives you an idea of how you can query and get different information on the tool. So if assuming you want to do a filter for any of the assessments you've done, you can click on filter. It gives you different options. So assuming I go back here, I reset this and I click on filter. So when I click on filter, it shows me so many options I could click on. Now, because I want to click on what I've done today, I just click on registration and I say save. Now this takes me to where I can look for the registration number of what I did. Now, remember I said you needed a registration code. So I've been looking for reunion, assuming that's what I did. So this is reunion, and I click on reunion. So it applies the filter. So once it applies the filter, it gives me a sheet that shows what reunion has done. That is the assessment we did. So coming here, it shows that, remember we said if you've not done an assessment before, you put 0 on that number of assessments. So this shows that this is the first assessment that is happening here in reunion. And after a first assessment is done, it shows that the overall score for the supply chain was 39.7%. Now, what does that mean? Because 20 categories were assessed. So when you come down here, there's a badging method. Remember, we talked about that. And the badging says that 39% that the union has scored comes under bronze. That means the union can still go silver, gold, and accredited if they want to be. And I'm sure they want to go there. So based on that, we now have a breakdown of the 20 categories that were assessed. Now, this chart you see here is a breakdown of what has been scored by this country or this supply chain program under the various categories. Now, if we go a little further, it actually gives us a breakdown of each of those categories in a chart. Now, like we said here, facility level visibility here, I don't know if you can see it clearly, is 40%. And at this 40%, they are at the bronze level. So if you come here, you're able to see it more clearly, more visibly. So category breakdown here is 40% for facility level visibility. At inventory level is another 40%. Order management is 46.7%. So as you keep going down the chart, you'll see all 20 categories listed and what has been scored. Now, besides that, like I said, there's a drop-down button here through which you can access any information you want to have. So assuming we want to go there, okay, let's see what all the other responses are. We want to check something else. So you click on that, it takes you to all responses. So depending on which one you click on, we're going to be going through all of them. So if you click on that, it takes you to all responses. If you click on the first one, it takes you to all responses. Now, all responses gives you an information of all the responses that have been carried out so far. So for here, we have about 232 responses from 32 African countries. And then it also gives an aggregate of all the performances for each of the categories. So besides that, you can also see which organizations have been doing the assessment most. You can see that 72.4% here is for public organizations, there's private organizations, and just 3.4% are NGOs. And then you can also look at which supply chain stakeholders are represented in the assessment. Is this national, is it state or county? So for every information you have put in the profile, you have to put it correctly, because you can come in later to query by those information to see how well the supply chain is doing. Now we also have badging levels by category. So if we look at this now, 48% is canvas here. And if we come here, you can see that some of this information has already been provided up above the levels. So for each of them, how many of them have facility level visibility at canvas level? You can see that it's 48%. How many have it at bronze level? Is 43%. So there are different ways in which you can query this tool, query the categories to be able to see what exactly the supply chain is performing. Now, besides querying all the responses, you can also query some other information. So if you assume you want to query the team aggregate responses. So when you come here, we have done, you have a team current response that you've done, which has showed us that 232 categories responses have been provided, which an average of 51.1%, and this is on the gold level. So this is another one that shows you the breakdown of all the categories depending on the countries. Now, there are also other queries that you can do if you want to do a team aggregate response. The team aggregate response is just for the number of surveys you've done. Now, this can give you a number of surveys done over time. So in this case, you can select by registration ID, and it brings out the responses for that particular registration ID over time. So imagine that query by one of the countries or your country, it pulls all the queries, all the assessments that you've done and all the answers, and you can see how you have performed over time. For this, like this one, in July, it had 27%, and then it went up again in August and then came down. So it shows the different categories and how assessments have been performed over time. This is a general one. It can also show how each category has performed over time. So depending on what you want to query, whether you want to query by category or whether you want to query over time, you can see each of the performances. Also, you can see responses over time by version. Like I said, this is the version 8. This is the first online version, but we have the version 6, version 7, the previous versions. Now, all these have also been put into the database. So you can query how well the supply chain has fared on the different versions that have been used. So like we have seen, okay, by using version 6, what was the overall assessment by score on version 6? It was this. On version 7, it was this. On version 8, it was this. Now, this is because there are also a few changes in the questions that were provided. Some of it were modified, so it's able to give those different answers. And then you can pair and query your assessments by category over time and by version. So you can query visibility level by version, query visibility level over time. So depending on what queries you want to provide, all the answers are provided in the tool. All you need to use is the filter button. And also you can query by country or region. So you can compare countries, compare regions. By this, you just use the filter button and query the country you want to access. Now you can query the countries you want to access. So in this case, you need to select multiple countries when you come here. You have to select multiple countries to be able to query and find what information you need. So if you're selecting by countries, you can just say maybe African countries, and click on that. So you click on the African countries you want to query. Maybe you just click on this and you apply filters. And when you apply filters, it brings out those countries. It pulls for a bit and then brings out the countries. Like I queried 3 countries and it's brought out the comparison for 3 countries. So you can query at most 15 countries per time. And so it queries by region, queries by country, and you can see and assess how well each country is doing and how well each supply chain is doing. So there are so many features that the tool has. You can also set goals or create stories depending on what you want to do. Sometimes we need to set goals for ourselves, we need to set goals for the program, and then we need to set goals for different aspects of the supply chain. So if you need to set goals, you come here, you click on the goals tab, and then you look at it. What kind of goals do I want to set? Am I setting goals as ASCM, or do I want to set goals for my own organization? Like to me, my organization is XYZ. I come to this place and I click on new goals dashboard. So it gives me an opportunity to type in the name of my organization. And then when I come here, I just click on add goals. Now, once I click on add goals, it gives me a space to be able to type the goal at which I want to add. Once I type that in, it gives me an opportunity to create that goal. So assuming I say SAPICS 2020. So as it's SAPICS 2020. No, sorry, SAPICS 2021 by 10%. Let me frame it another way. Increase the number of sites by 10% by SAPICS 2021. Assuming this is a goal I want to set. I just come here and I say, and I do that. And once I do that, it creates a goal for me here. And once it creates that goal, I need to add indicators. Once I add indicators, each time I do an assessment, I just come in there and see how well I'm doing. To see whether the number of sites have increased, I can come in there and fill it manually, or I get it automatically filled. So this is what it is about by setting goals. Now, besides setting goals, you can also create stories around the supply chain. Now, in creating stories, these are just maybe milestones or something that happened and you feel we need to talk about. So if you want to create a story and maybe to remember a milestone, you can just click on Add Story. Once you click on Add Story, what is your story about? So you can say, happy to be at SAPICS. Maybe when you were at SAPICS, you had a good news about the performance of one of your categories. Happy to be at SAPICS 2020. So happy to be at SAPICS 2020. Right. Great. So what emotion do you want to display? Was it good? So you say it was good and during the post. So once you post, it comes here and it shows that on the 17th of November, you had good news. Your sites had increased and then you had SAPICS 2020. So it just gives you a way of remembering the different things that happened over time and how you need to express your mood, express your emotions. So if you look at the tab here, you see that we have created different modes at different times for different things that were happening. So this is part of the ways also that you can use the tool to be able to access and inform yourself on the different things. Now, this data page is supposed to be, this is the back end, which is not necessary for you as it's just used for information purposes. So definitely this is just the back end. You do not need to access this. Where you need to access is the metrics, the goals, the stories, and the stories. So this is what the maturity model tool is about. We're open for questions, and a lot of support can be provided each time you need to access the tool. Like I said, the website is www.ascm-ghsc.org. This is where we can find information on the tool and also access the online version of the tool. So basically what we've done is to give you a highlight of how the tool works, how the digital output is provided, and how you can query the tool to be able to provide you with different informations per time, and also to be able to create your stories, create goals, set milestones, and see how well you are performing. So we'll be going back to just talk a little bit as to what next after you have created and performed your assessments and you found, okay, I need to improve in this area, so what next? And also, what are some of the benefits of using this tool as against other tools? Like we said, this is not a quantitative tool, rather it's a qualitative tool. And that's part of what makes it different from the other tool. And then this is a self-assessment tool. You do not need to have anybody come administer it for you. As long as you've been trained, you can access this tool. You can use it within your programs at different periodically. Once you set your own schedule, you do your improvements and you come back after a while to see how well you have performed. So basically, the tool is an in-house tool for you, self-diagnostic, and it's not an audit tool. It's just for you to know how to improve on your processes over time. So what is the benefits of using the Global Health Supply Chain Maturity Model tool? There's so many tools, but what do you think is the benefit of this? One is that it's rapid. The assessment is rapid. Like I said, once you've gone through the demonstration site and you understand all the questions, gone through the other sites to see the tools that you need, like the playbook, the toolbox. Once you're conversant with that, doing an assessment takes just like 45 to 60 minutes. It's low cost implementation because the tool is available online. You can use it online without any additional cost to you, except for maybe when we need to train you. But once you're trained, you can run with it. We'll just provide some support in terms of ensuring that there's quality. So it's really low cost to implement, and it allows data to be collected electronically and displayed. And you see, this is very user friendly. Like I went through all the tabs and you can see that as long as you have stable internet, it is very user friendly. Also, the assessors do not require in-depth training. I'm sure from the presentation we've had today, you can go ahead and even do your own presentations and have your own assessments yourself. So it's not so complex, it's user-friendly, and you can always just go to the website and access it to be able to assess your supply chain performance. Now, some of the feedback we got from some of the users is what I have displayed on the screen. These are users in Nigeria that have used it for quite some time, and these are some of what they have to say with regards to the tool. So like I said, this is a really simple tool to use. You don't have to go too detailed as to, or make it too complex when you want to assess the supply chain. It measures end-to-end supply chain, and you're able to have a full picture of how each of the categories of your supply chain is performing. So what next after you have performed an assessment? You performed an assessment, now you know what the issues are. So what do you want to do after that? What if I'm not doing well in visibility, facility level visibility? What if I'm not doing well in human resource management? So what happens after that? What do I do? So I'm going to show you the toolbox again that has a lot of support documents that provides information on what you can do. It helps to guide you on how you can do a problem solving analysis or technique on how to get to the root cause of the issues. And from there, you're able to provide enough improvement plans to be able to carry out an improvement work on your supply chain. So when you go back to the page where the tool can be accessed. That's the ASCM-GHSC.org. That page, you just scroll down again, like I said, and you come to the Toolbox and Training. Now, the Toolbox and Training is where you can get support materials to help with problem-solving methods and techniques to help improve your performance. Like I said earlier, it has the English and the French version. So you have learning materials here, which are documents that ASCM has provided. And then you also have here a synopsis of problem-solving tools and techniques. So if you open this, you have different techniques that you can use to understand why your performance is suboptimal in that area and what you can use to do a deep dive or a deep analysis to get to the root cause of why the supply chain has been poorly performing. And this, like I said, is not prescriptive, it's just a guide. And with the consensus from all the teams conducting the assessment, you'll be able to have a root cause analysis and from there provide some improvement plans. Now, the thing with improvement is you can have some that are short-term, some are mid-term, and some are long-term. But for you to make some progress, you need to be able to work on those that are your low-hanging fruits, the ones that you feel that if you can easily influence or quickly influence, it would have some impact on the performance of your supply chain. So you can start with that while you keep working on developing and achieving the medium and the long-term goals. So basically, this is what the tool does. We're able to provide as much assistance as possible. If you need to carry out this assessment or you need to train your staff on using the tool and to carry on in improving your performance, our goal is to see that all supply chains are improved, is to see that there's enhanced accessibility and availability of health commodities to those that need them. So this is where I'll be ending this workshop. Thank you, and we'll be taking your questions now. Thank you.